My name is Juan Matute. I'm Deputy Director of the UCLA Institute of Transportation Studies, and I've been asked to talk about new mobility, future of mobility, and intersections with public health, so I'll be doing that today. So what do we have in terms of new mobility? So some of these are literally on the streets, so bike share, both electric, dockless, and docked. You may have seen a bike share station as you walked in here today. Different rideshare and carpooling type services. So this is a service called Waze Carpool. There's others. Microtransit, that's an example of a microtransit company, not always successful. Uber, Lyft, probably most of you have used those. Courier network services that deliver food and goods, often through freelancers. Self-driving cars currently being piloted in our closest state to the east, Arizona, and soon in California. Employer-based shuttle transportation, docked or station-based EV car share available in Los Angeles. Maybe you've seen it on the streets. And then, of course, everybody's favorite new mobility option or menace, the scooter. So these things, they're on the streets, they're the talk of the town, they're literally the talk of the streets. They kind of market themselves. You know, you see this view here, there's all these scooters there, you maybe have to download an app and take it. This is actually a picture I took this morning of my commute to UCLA, and if I saw that and I was in a car, I'd say, well, my car can't fit through there, but a scooter definitely can. And I'd say, well, this is perhaps a viable option for getting around, perhaps a little bit more active than sitting in my car. So will this new form of mobility challenge the dominant form of transportation in Los Angeles, which is the car? Or it will be just swept away as another fad? So there's questions about scooters, whether or not they're safe, how they're operated, how they integrate into communities. I was looking up this quote, something that I've heard a former transportation commissioner from New York mentioned quite often, attributed to a former mayor of New York, Michael Bloomberg. "In God we trust and all others bring data." I actually saw that the original source is a professor of pathology, Edwin Fisher, so I guess it's quite apropos for the talk today. So there is fresh research just out this week from colleagues at UCLA on emergency room visits for scooter injuries. So quite fresh, looking at visits to Reagan and Santa Monica medical centers, 249 patients. Some of them had a blood alcohol level of over 0.05%. Many of them weren't wearing helmets, but my takeaway here, what I saw as an occasional user of scooters and a frequent user of bicycles, is that fractures were one of the most common injuries, and especially distal upper extremity fractures, so the forearm. So why might that be? Is that because there's somebody irresponsible on a scooter, or is it because of the quality of our roads? So this is another picture I took on my route to UCLA today, which is on the direct bike route between UCLA's Santa Monica Medical Center and Reagan Hospital. And I'm on a bike, it has pretty good inertia. If I'm on a scooter, this might trip me up. So that's a picture I took, and then this is another picture that was featured in Metro's blog. But it's just somewhat illustrative of the state of the roads, the conditions that lead to some of these fractures. Perhaps it's not all attributable to user behavior. So in looking at data on how to reduce public health impacts, particularly severe injuries and deaths around transportation, the city of Los Angeles has done this and found that although only about 8% of collisions by mode are people walking, those account for 44% of deaths. And so we have a rather extensive street network in Los Angeles. How do we address this? Well, you got to start somewhere. So the city narrowed down that 65% of those deaths and severe injuries of people walking occurred on just 6% of those streets in the city of Los Angeles. And so, okay, great, you know where to start, you know what to do, you make the street safer for all road users, you provide more crossings more often, bike lanes, etc. So one of the initial streets they picked was this long, conspicuous one that sticks into the west side, and implemented a parking protected bollarded bike lane and a segment of Venice Boulevard which you can see there's these road users here, probably saving some time, a little bit safe, no potholes here. And so this was an evidence-based intervention to enhance the safety of all road users. That was vociferously opposed. So this is the background image from a website that was used to sign a petition to try to get this decision overturned. There was some political fallout. There was a group that attempted to recall the council member who approved of the decision. And so this is what happens in cities when you try to do evidence-based public health interventions. We know that transportation, particularly automobile pollution, is bad for communities. We've had research from UCLA where they've taken the electric vehicle out, done micro-scale monitoring of air quality, different neighborhoods. We know that the community of Boyle Heights, which is surrounded by freeways, has much higher concentrations of NOx, ultrafine particles, particulate matter concentrations. We know that ultrafine particles are still a new area of research, and they're not properly regulated because they're regulated by weight, and they're tiny. But we know that they can cross the blood-brain barrier, and that, I think, is a significant public health issue. And we know that there are disproportionate impacts in communities of color, low-income communities, and that is a direct result of traffic volumes in those neighborhoods. From a prior study done by researchers at UCLA, we know that women living near heavy-duty traffic areas in the city of Los Angeles were at increased risk of premature delivery and low birth weight babies, which to me is an eye-opening thing. You have to do something about that. But sometimes people jump to, well, what about electric vehicles? Won't that solve pollution? If everybody had one of these, wouldn't that actually fix things? So, especially in the context of automated driverless cars plus electric vehicles, that solves everything. We don't need to worry about problems anymore. But as Dick mentioned, as others I'm sure are concerned, climate change really changes everything. And so with a changing baseline climate condition throughout the US, but especially Southern California, we're worried about increased exposure, increased incidence of heat-related illnesses and mortality, especially among vulnerable populations. PM concentrations and associated health effects go up with temperature, and extreme heat may actually reduce all of these things that we are trying to retrofit the built environment for, increases in biking, walking, outdoor exercise. We know that wildfires are increasing in their threat, severity, risk in California, just both the direct effects of conflagration and also increases in particulate matter from smoke. And we know that changing temperature is causing problems. So we have research from UCLA that looks at potential increases in future temperature due to climate change. And we see the places where there's a lot of zoned growth, like Bakersfield, Riverside, Palmdale, are going to take the disproportionate impact of increases in temperature, whereas places like downtown Santa Monica, Long Beach, downtown Los Angeles, Long Beach, and Santa Monica will be more spared. So this is a look spatially at increases in future temperature in the Los Angeles, Southern California region that are expected as a result of climate change. Because not everybody has a map of the future transit system in their head. I've overlaid what that would look like. And they're actually building a fair amount of new transit metro lines into these communities. I'm going to look at what happened when there was an attempt at evidence-based interventions at one of those, so particularly the 26th Street Bergamot Station along the Expo line. There was a site right across the street from that line that was slated to consider a transit-oriented development. And this concentrates population away from wildfire, away from future heat impacts. And it was actually approved but then overturned because of community opposition to the project, the density, the potential car trips from it. So this is hard. There have been some progress towards evidence-based interventions to mitigate the potential future impacts of climate change, to address health outcomes from the integrated transportation land use system. The new governor seems pretty bullish on a new housing in coastal areas, so this proposed withholding the state transportation funding from regions that don't meet housing goals is having the Attorney General sue the city of Huntington Beach, which is faring well in future climate conditions, over violations of California's longstanding Housing Accountability Act. And then there's an ongoing effort from Senator Scott Wiener's SB 50 to reduce and remove local controls that prohibit transit-oriented density. And I know that he had a bill last year that was widely opposed, but his colleagues have made him chair of the Housing Committee. So that gives a little bit of a sense of the temperature of what's happening in Sacramento and their understanding of these issues. If you love this and want more, we're doing a March 1st event on From Public Transit to Public Mobility, downtown Los Angeles. You can check our website. And if you want to reply your criticism or hit me up in the panel, I'm on Twitter. And check out our website if you'd like to see some more.
All right.